Today is Monday, October the 13th, 2025, and you have joined Ask a Care Navigator, Mondays with Maureen. Hello, everyone. My name is Maureen Williams, and I'm the Director of Care Navigation here at Four Seasons, the Care You Trust. And we try to create this space on most Mondays to talk about issues associated with living well and aging well, and perhaps how Four Seasons may be of service. And I'm going to be telling you about what this book has to do with Breast Cancer Awareness Month very shortly. But first, I am delighted to share, and I'm so grateful to the Van Winkle Law Firm for serving as the title sponsor for Ask a Care Navigator Mondays with Maureen. The Van Winkle Law Firm is one of the most respected and established law firms in North Carolina, providing exceptional legal representation to individuals, families, and businesses in personal, commercial, business, and estate planning matters. I've worked with them many times for many clients, and they really are top notch. Should you want more information about Van Winkle Law, please visit their website, which is www.vwlawfirm.com. You can learn more or schedule a consultation. Someone would be happy to talk with you. Well, should you have any questions or comments about anything that I say, please call us at 866 466 9734 or go to our website, which is fourseasonscare.org. Please spell out the number four, FOURSEASONSCARE.org. Or you can drop a comment into whichever platform from which you're viewing right now, either now live or later. We'll be happy to speak with you about that. So, having said all of that, I talked last week about breast cancer. I shared some personal things about my journey. And because it is National Breast Cancer Awareness Month, I wanted to share information with you somewhat from a personal perspective, some things that I've learned, but also from research, and particularly for breast cancer in the elderly. It has different perspectives in how we treat this growing population. And the information I'm sharing with you today comes from the Breast Cancer Research Foundation. So lots of good research going on out there, but not enough. So unfortunately, breast cancer is like most cancers, it's a disease of aging. Yikes. I had never thought about it till I read that just earlier. Breast cancer is a disease of aging. The median age of a breast cancer diagnosis is 63, and nearly 20% of women diagnosed are over the age of 75. That's a very large population. In fact, we know that women in their 70s have the highest risk of a breast cancer diagnosis, and women in their 80s have the highest risk of death from breast cancer. Wow. Wow. We know of the 42,000 patients who die each year because of breast cancer, more than half are over the age of 70. So what do you do about that? Wow. My mother was 43 when she died, but that was 40 years ago. Breast cancer is now a disease of those who are aging. So what do you do about that? First of all, knowledge is power. Unfortunately, there are very few standardized guidelines for how best to treat and screen this population. So that's unfortunate. So some of the ways that the elderly experience breast cancer are very different from a younger population. So how does it affect the elderly? And you can define what you believe to be elderly. We know that while more favorable breast cancer subtypes, by the way, I learned there's so many types of breast cancer and subtypes, it's overwhelming. But while more favorable breast cancer subtypes are prevalent in older women, more aggressive breast cancers are not uncommon in older women. I was fortunate. I was very fortunate. We also know that older patients can respond to treatment very differently for any type of cancer. For example, chemotherapy requires a balance of providing standardized treatments of care at recommended doses while monitoring for drug toxicities and side effects such as congestive heart failure and osteoporosis, balancing that and quality of life. That's important anywhere along the cancer journey, but we're we're focusing on breast cancer today. We know that elderly people with breast cancer are at higher risk for possible treatment related side effects and for treatment related mortality. Excuse me. We know they can have more side effects because of their treatment and higher mortality because of their treatment. Let that sink in. But unfortunately, undertreatment at any age is linked to poor outcomes. So that's a real delicate balance for the elderly patient with breast cancer. Regardless of type of cancer, breast cancer or subtype, patients over 75 years old do not always receive appropriate treatment. And that's unfortunate. This is due to lots of reasons. Proper assessment of one's functional age. There's a lack of available data in older adults with cancer to know how to best treat them. So it's important for caregivers and patients, the caregivers and their patient, the patients and their caregivers, I'll get that right, their loved ones, to be very clear and define your goals of care and your goals of treatment with your oncologist, along with the potential side effects. And when I read a phrase like that, my brain automatically goes to palliative care. Palliative care, those are experts in goals of care conversations, particularly in the context of complex medical decision making. And believe me, cancer demands complex medical decision making, and it should. Now, functional age is different for many different patients. There might be a 75-year-old who is very independent and active and appears very healthy, while another 75-year-old might be confined to home or even bed or wheelchair. How cancer affects one individual patient over another really is dependent upon one's functional age. So I talk a lot about living well and aging well, and that's about having a better functional age than your chronological age. So it might be do well for your providers if you're in these over 70 years of age categories. Your provider should be asking just a few key items of a geriatric assessment, like, have you had any falls? This is important. Can you walk a block? This is important. This helps them to determine functional age so they can better craft a plan and treat you properly. In fact, I love this as part of research. A geriatric assessment is now recommended for almost all older patients with breast cancer. And it's especially important in older women considering chemotherapy. I love hearing that research has driven us to that point, and it needs to go further. Okay? And because of that, we do need more research in breast cancer in the aging adult. Older adults are often excluded from clinical trials because the cutoff might be an age or the level of health or functional health. And that's why we often have a real lack of clear evidence based guidelines on how to treat breast cancer in the aging adult. It's important to understand how toxicities of cancer therapies will affect an older person. New drugs are not adequately tested and tested adequately in an adequate number of older patients. I'll get it right yet. It's important to have good data, and that studies have just begun in breast cancer and other cancers to explore these issues associated with toxicities and treatment responses in older adults. In fact, one researcher said the geriatric oncologist is a rare breed. And I believe that absolutely. So, one researcher in breast cancer, she wrote, um, she considers it privilege, by the way, to work with geriatric breast cancer patients. But she writes, I advise them on their cancer, and they advise me on my life. I become part of their family, and vice versa. Hugs and kisses are a big part of my clinic day. So it's important to be very clear with what your goals and your guidelines are, your treatment outcomes, what your quality of life looks for you. And for my cancer journey, I found, and for any of you, and people have asked me since, what would I advise if when they're diagnosed with breast cancer? Get a journal. This journal represents every document, every note, every phone call, everything since July 31st, 2023 at 7:55 in the morning when my gynecologist called me to say the results are positive, to just recently when I met with my plastic surgeon for my annual checkup. There's lists of phone calls to make and conversations I had with physicians and surgeons, all the diagnostic work that I did, every business card, every appointment card, every lymphedema therapy treatment I had. It's all in here because for me, it was overwhelming. This helped me organize things. Some people might do it on an electronic, on a phone or something, or an iPad or a computer. But I took this with me and it was so helpful because I wouldn't remember things correctly. I didn't always remember things correctly. It's a lot of information. So I really recommend everyone who's walking through a breast cancer journey in this pink month to consider journaling your activities. In fact, I can encourage you to do that for any breast cancer, any cancer journey. You're going to have lots of appointments for lab work, for diagnostic work, for scans, for meeting with surgeons, for meeting with oncologists, for meeting with your primary care. You're going to have lots of appointments. This will help you. Okay. And believe it or not, you're going to have lots of support along your breast cancer journey. I'm so grateful from the professionals with whom I work to friends and church friends and coworkers. This also includes conversations I had with one of my coworkers who'd been in this journey far more dramatically than I. And before me, she was really helpful. She's a nurse practitioner. It was really helpful to have her on my team and on my board. But there's lots of support out there. Should you need the help of a care navigator to help you navigate this journey, Four Seasons Care Navigation would consider it a privilege to be of service to you. If you need some additional help in the home while you're going through your treatment, because it's exhausting for some people, and again, women over the and patients over the age of 70, the treatments can be a bit more dramatic than they were for me. But Four Seasons Home Care would be honored to be of service as well. Or if your breast cancer or any other type of journey is really becoming complicated and you're really challenged with the side effects and it's really taking its toll on you, Four Seasons Palliative Care would consider it a privilege to be of service to help you navigate your health care in the context of complex medical decision making, help you clarify your goals of care, and help you with symptom management. Sometimes that symptom management is related to your treatment. So much to consider. October is National Breast Cancer Awareness Month. I'm picking it up for it today, and you may be finding yourself in that same circumstance. Should you have any questions, please call us at 866 466 9734 or go to our webpage, which is fourseasonscare.org. All right, thank you for joining me today, and join me next Monday, October the 20th, for another topic going to be related to Medicare, but it's associated with living well and aging well, and perhaps how Four Seasons may be of service. I'll see you then. Thank you.